Hi, I'm Dr. Chawla. We're still at the PCRM conference, and I'm here now with Dr. Andrew Freeman of Denver, Colorado. He practices cardiology there.
I do.
Dr. Freeman, tell us why you recommend plant-based diets to your cardiology patients.
I think the overwhelming evidence that's been published to date is irrefutable that there's only one diet known to man that can reverse heart disease, which is a low-fat, plant-based, whole food, unprocessed diet. And at the end of the day, when you look at all of the data from a purely evidence-based view, there's really no other diet that's ever shown all of this magnitude benefit. And on top of that, this very same diet also has benefits for cancer, the #2 cause of death in the country and in the world, and many other chronic diseases. And if you look at the bottom line, what is the mechanism behind virtually every disease? It's inflammation. And if we can get rid of the inflammation through putting your body in a milieu that's anti-inflammatory, amazing things happen. And so I work at a respiratory hospital, National Jewish in Denver, and I see patients all the time that have asthma, COPD, advanced lung disease. And when I put them on this diet for their heart, it almost always helps their asthma, and it's pretty amazing actually. And if you look, we put a lot of these people on prednisone, steroids, and all these other things. How do they work? They cut inflammation. But what if we cut inflammation without a pill and put people in the right environment? That's where the real magic is. And the results from a heart standpoint are just dramatic.
Awesome. Well, you guys heard it here from Dr. Freeman himself. Thank you so much for your time, and thank you so much for all that you do for
My
your
pleasure.
patients and our community.
My pleasure. Well, thank you.
Hi, I'm Dr. Chawla. We're here at the PCRM conference in Washington, D.C., and I've got Dr. Douglas Vaughn of Dallas, Texas with me.
Hello.
Dr. Vaughn, tell us about what you do and how you use plant-based diet in your practice.
Yes, I practice in Dallas, Texas. I'm a spine surgeon, and also I practice regenerative medicine and orthopedic stem cell therapy center. Whole food plant-based is extremely important and critical to our surgical patients as well as regenerative stem cell therapy patients, as it elevates the nitric oxide, which also activates and mobilizes the stem cells. So all of our patients who are going through the surgical treatment or stem cell therapy are counseled by myself as well as our nutritionists so that they can transition into whole food plant-based so that they can optimize either the surgical outcome as well as the stem cell therapy as well.
Thank you so much, Dr. Wen. Hi, I'm Dr. Chawla. We're still at the PCRM conference, and I'm here with Lee Crosby, registered dietitian at Barnard Medical Center, and she just gave a great talk on ketogenic diet. Lee, can you tell us why you don't recommend ketogenic diet to your patients?
There are an awful lot of reasons I don't recommend ketogenic diets. It's hard to know where to begin, so there are lots of short-term side effects, some of them even called the keto flu. We know you can actually induce insulin resistance in young healthy people by putting them on a ketogenic diet for just a few days. Long-term, we know there's an increased risk of dying from all causes if you're on a low-carbohydrate diet, and keto diets tend to be the most extreme version of a low-carb diet. So those are just two reasons. I could go on and on. It's almost like one of those drug commercials where there's so many reasons not to do it, but those two would be the top of the pile. And also the fact that this kind of diet would eliminate the foods that we know have been proven over and over to promote health and longevity. So not recommending keto diets at this time.
Thank you so much. You heard it from Lee Crosby.